Peter Szekely. Welcome to the Lean and Lethal podcast. And as a brief intro, I believe 2011 was that what we decided as to when we kind of met back in 2011. Well, we knew each other before then, but that's when Peter was actually my coach in the competitive swimming world back when I was still doing that. And then he went on to swimming in college, then going on to medical school abroad in Hungary. And now he's working on getting the medical license here in the U.S. So big swimmer, obviously growing up, swimming in college. Did you really do any other sports growing up, or was it mainly just swimming?
Yeah, so pretty much it was mostly just swimming. A couple years in high school, I did track and field, some hurdles and some high jump. But besides that, probably just swimming mostly. That's pretty much been the name of the game since I was a kid. But just a little bit. So yeah, no football, nothing else like that.
Did you always have the intention to eventually swimming in college?
Oh yeah. I mean, honestly, I love swimming since I was like a kid. My dad obviously was a swimmer and stuff, and growing up, I always, he was always really big into it, and so he put all of the kids into it, and yeah, we got into it. I think we're all pretty good at it, and myself included. And I wanted to do it in college someday at a collegiate level, and it worked out. So ended up going to Colorado Mesa University and swimming there for 4 years. So yeah, great experience.
Was that kind of the end of the road as you saw it, or were you striving to get into the trials?
Honestly, I would have loved to. Some of my cousins went to trials and stuff, but yeah, I would have loved to. Didn't quite get there. I think nationals was kind of the end of the road for me. So after that, I was like, all right, I'm gonna call it a day and pursue more of like the academic career. So, but that was great for me. Honestly, when I finished my swimming career, loved it, but definitely ended on a good note. But I was ready to pursue new things and try new heights of sorts. So, but I still swim though. So I still love doing it for exercise.
So you knew swimming was obviously the kind of sole focus from an early age. What about on the career side? Did you see yourself? What age did you kind of decide that medical school was the route for you, and that was the kind of career you wanted to focus on?
Yeah, that's a good question. I mean, I would say from a young age, I was always interested in biology. Love being outside. I spent most of my childhood outdoors. Loved, just biology type stuff, animals. But I'd probably say by age 10, I kind of was like, hey, like I like the science route. Not sure where I'm going to go with it. Got into college, majored in biology, minored in chemistry. Got to the end. I think I always had medicine pre-route in my mind, but it was never like, this is for sure the way I'm going to go. Long story short, I took a year off after college and did some working in the real life and talked to some people, my dad included. And I think I got some good advice on just how to go forward. And I ended up just making the best decision I felt like going through with the medical career. So, yeah.
How do you think athletics, especially like in college, set you up to go into the medical field? Because obviously there's a lot of extra time you got to dedicate to swimming in college, and there's a lot of extra time you got to dedicate to studies in medical school, where it's like you can't live the normal life as most people at that age, going out and partying every single night.
That's true. I mean, honestly, it just teaches you about hard work, teaches you about never giving up. For me, that was like two big things. I mean, number one, you got to have the motivation to be there and to do it. You got to be able to believe in yourself. You got to put the time in. And I think for me, like school and swimming were always like, they were just equal in my mind. Like I wanted both just as badly. So, I mean, it was hard for sure when you're doing 2 to 3 practices a day. You got meets on the weekend. And you do that for 4 years, it's a burnout rate for sure. But I think having a goal in mind was what got me through, never wanted to stray away from those goals of what I had in mind for swimming and for academics. So it's probably the biggest part.
Did the self-belief, then obviously you had years of swimming kind of growing up, going into college, so you're probably pretty confident in that. Do you think some of what you accomplished in the swimming aspect allowed for a lot more kind of self-belief and like confidence going into medical school that you could get through it and finish that out?
Yeah, definitely. And it's a funny thing because, like college is one form of academics and then doing the sports is another, and the combination's a lot. But it definitely it basically tears you down to the minimum. And most people, like it just helps you know in your own mind if you're going to be the one that gives up or you keep going. So it definitely taught me that. And then going into medical school when I didn't have to work out like I used to, all the energy I would have put into probably working out, I then put into studying. And, it was a new form of training for me, like another level. And for sure going in, it's like, I don't know if I can handle this. And there was times during school where I was like, man, this is a lot. But what I got from swimming was to keep going, don't give up, keep going. So,
what did you mean by it tears you down to the minimum?
Probably emotionally, like I would say, like, you can do a lot, but if you in your head you give up prematurely, uh, it'll just be an automatic fail in your head, you know. But it's, can you use that failure? Can you get back up and try again? So for example, like whether it was a swim race in college where I didn't go my best time, it was kind of like that want to really go and get that national cut, or to get in there and try again. Like it might have not went so good that day, you were tired, but by God, you wanted to do it again. You were excited to go out there and try again. And for me, I kind of took that into school as well. I think emotionally it could be a little bit exhausting. But even if an exam didn't go so well or something like that, you took a day off, you rested one, you got back after it, just put in that time, keep going. So yeah. And I think family's a big thing too. Like they definitely emotionally supported me a lot through that journey. Definitely couldn't have done it alone. Just someone just saying, "Hey, keep going, keep going, keep going," instead of letting your thoughts get to you. So
for sure. How much do you think your thoughts really play into the outcomes? Like, do you almost have to trick yourself mentally at some points in order to keep going and not really let your head take over? Because I mean, even like for me in the last year, diving into some of the endurance things, and
yeah,
like went and ran a marathon in
crazy.
97 degrees, just like without any training, or did like the 30-mile run in the middle of the night. And like both of those, it was like mile like 3, your legs are already hurting and you're like questioning why you're doing it and if you can even finish. Like I had never done it before, so it's like it's not like I had that experience to kind of lead me through, but like really showed that I think the power of the mind, especially for me, is like just not focusing on the suck and the pain and finding something else to focus on so that you can really just trick your body into going more. Because I mean, I think our bodies are way stronger than our mind lets us to believe.
Yeah,
What kind of role do you think that plays in things?
it's a big one. I had a coach in high school. You probably know, like Lev Bates and stuff, and he was a great guy. But we used to be doing planks out on the pool deck, and everybody wanted to go down, and he was like, it's 90% mental, 10% physical. And I do think that there is a balance between how much your body can keep going with and how much your brain is willing to let you go forward. So your brain thinks it's only 10%, but that's only if you let it. So in reality, your focus and your want to not give up starts here, and then the body can just keep going. So there's many phenomenal athletes out there that push through. David Goggins, guys like that. So pretty cool.
Do you think that's something that we're kind of born with? Something that like once you get that idea into your head, you can run with it, or is it something that you really got to work on developing over time?
I think it's 50-50. I think some people are born with it. Some got it, some don't. I mean, it's kind of like that inspiration. You don't really know where it comes from. Is it God given? Is it not? But I think you can feel it in your nature. You can feel it in your nature if that's something you're really passionate about. I think everyone's passionate about something, and but what is it for? And once you find it, I think it just emanates through pretty much everything that you do in your life. So I would say it's in our nature. But for sure, if it's not, like let's say you do something you don't want to do, then you really have to work at it. And there's nothing wrong with that. I mean, there's many things that I do, even in medicine, that I would say, hey, that didn't come so easy, but you got to work at it. So, it's a back and forth game.
So 50% nature, 50% nurture,
Yeah.
essentially.
Yeah.
So it took a year off after the initial college stint, and then I ended up going to Hungary for medical school. Why Hungary?
I know, it's a good question. I put a lot of thought and time into it. After I graduated, I decided, okay, I'm going to go the medical route. I took the MCAT. I passed it. Scores weren't like off the chart, but, I did pretty good in college, and I thought, that'll get me through. Opened up some doors, but number one, it's expensive here. And, that was a big component. Wasn't sure if it was the route for me, even in general, just with, medical school. So I took some time to think about it. I talked to PAs, I talked to nurse practitioners, I talked to MDs that studied abroad, some that stayed here. And I think ultimately it came down to a talk with my dad. So like he went to medical school abroad as well, and he just had a great experience with it. And I was thinking about it, and I was like, I was working here as a medical assistant, and I just said, you know what, I'm gonna give it a shot. It sounds like a lot, but I'm gonna give it a shot. So I turned in my application to this school in Hungary, and I guess I should preface that my family is Hungarian, so my grandparents are both from there. They have a pretty cool story. They escaped over from Hungary, didn't speak English. My dad grew up here first generation, and so swimming's always been a big thing. So my dad ended up going back there for school. Then he passed the idea on to me. I'd never been out of the country, so it was kind of a big idea. So I was working, turned in my application, got accepted. 2 weeks later, quit my job and left the country for about 6.5 years. So
wow,
yeah.
What surprised you most when you first got over there? Never having been out of the country, like what was the biggest initial shock once?
Well, first it was the humidity. First it was the humidity, but I would say just economically, Hungary is a beautiful country, but they just don't have the same things that we have in the United States in terms of like access to all the different types of groceries you could ever possibly want, or they have a lot of awesome things, but it's just not as accessible, I would say, quite as much as it is here in the United States. It's in a different language. You want to look something up or know about something, it's not always in English. So for me, learning a new language was a big change. Learning about the culture, the way people think about things. It's just not the same. Even their jokes are different. So learning how people think and relating to them was a big one for me, and I loved it. Yeah, I loved it. It was awesome. So yeah, probably the culture, the language, learning how to use different types of transportation, just in terms of it's a different function there. More people use public transport, the buses. People live in apartments more so than they do houses. So different game.
So how many years did you spend over there then?
About 6.5. Yeah, about 6.5.
So out of that 6.5, how long would you say it kind of took you to get into maybe a natural rhythm and kind of assimilate to the culture with that like initial adjustment?
Probably took about 1 year. It probably took about 1 year. We got in there. Obviously, there's two different programs. There's a Hungarian medical unit, and there's the international one. The international Hungarian medical school, they're in the same medical school, but the international one brings in people from all over, every different country. And we had to go and take Hungarian class, medical Hungarian, twice a week or 3 times a week. So yeah, that was just, it took probably about a year to kind of acclimate, get comfortable speaking someone the language and things like that.
What would you say would be the hardest part going to medical school abroad?
Oh,
both academically and like maybe on like the emotional side of things too.
Yeah, I would say our oral exams. So the hardest, what was new for me is I'd never taken oral exams before. But for example, like my internal medicine exam, like my last year, and this is a classic format for I think European schools and especially Hungary. You'll learn 300 topics of internal medicine, and then you go in and you pick out 5 topics randomly from different categories. Like let's say it's GI or it's nephrology or something, and there is any number of topics. You pull them out, You see what the topic is. You get about 10 minutes to take some notes on those, and then you're examined by doctors or PhDs if it's earlier years of the basic sciences, and they're just going to question you until they think that how much do you know, and did you pass in their eyes or not. So it's pretty hard because you're dealing with a large volume of information. You got to be organized in the sense that you got to know every topic at least kind of okay, which is a lot. So that was the hard part, learning that. But once you get that down, you get comfortable, I think, explaining yourself, giving your reasoning behind things. And I think it makes you a better people person. But it's not to say that we didn't have, written exams too. We had plenty of written exams, whether it's essays or multiple choice ones, but the big ones, always at the end, were always oral exams. So that was new. You know, sometimes, and usually get a few attempts at each exam. So if it doesn't go perfectly well, you can go in and try it again. But there's like 3 attempts total. If you don't do that, you repeat the year. So
wow,
yeah,
sounds like it's pretty subjective though. Then
can be.
if it's just,
It can be.
did you ever find like either with you or with like other people, like were you interacting with the people that were giving your oral exams like throughout the year? Like, did you know these people, or did they come in from other places?
Yeah, it's a good question. I would say most of the people that are teaching the student level, so the professors, the big professors are the ones that are going to give the big lectures, and they're talking a lot, and maybe you'll have them for anatomy dissection or something. But usually there's some sub guys that will teach you throughout the year in your smaller courses. But then when you come to the final exams, you'll probably have one of the head professors, and I mean they know a lot, and they always know more than you know. That's for sure, whether you think so or not. So yeah, you know them, but not on a personal level. And they see so many students, so you just
So you never felt like it was kind of an issue where like maybe one professor didn't really like the Americans and was a little harder on him? That never seemed to be a big thing with the subjective side of things.
yeah, I don't know. I didn't feel like there was too much about a personal thing, but I
That's
just
good.
think that like they could just tell if you knew the information or not. And the thing is I mean, like for sure, like some professors like in a bad mood that day, they might just ask you things that are just not even your notes, and they might not like you that much. For sure, it could happen. But I always felt like you always learn something from it, and so even if it exam didn't go perfectly and you try it one more time, you got something out of it. But yeah,
Why'd you choose internal medicine?
well, internal medicine is kind of the gateway to all the subspecialties. So if you go to an internal medicine doc, they manage a lot of different diseases. Like it's a bit more broad, but every cardiologist, every pulmonologist, every nephrologist, all these guys, or gastroenterologists, they have to first do 3 years of internal medicine, you know? So then you can either choose to stay in internal medicine and manage more patients, or you can choose to subspecialize, which is more time after that. So it's not a matter of, it's more, I guess I would say it's an order of operation. You have to do internal medicine first, and if you really feel drawn to one of the subspecialties, you can, or you can stay in internal medicine and choose to help people on that level, which is still pretty in depth. So yeah, but
That's what you're
sorry, go ahead.
good. Your dad's internal medicine, right? And he didn't specialize in anything.
Yep, he stayed internal medicine. Yep, he stayed there. He actually also has a twin brother who is a pulmonologist, who did internal medicine and then did pulmonology. So I think it comes down to like where you're at in life. My dad already had kids by that point. He was working a lot, so I think life plays a role in how far and where you go to. But I think my dad, for example, would have loved to have done cardiology, for example. But you know, but I think he's loved doing internal medicine too. And I've always felt like he's put a great positive spin on it. He loves working with patients. I think he's a great people guy, and that's something he's always kind of imparted on me. It's about your relationship with your patients. So being able to do, for example, outpatient care where you can know your patients and use medicine at a high level has always been, something that he's preached. So yeah, so it's definitely played a role in my direction.
Are you going to stay at that level then, or do you think you're going to subspecialize?
It's a good question. I mean, like I love sports. Yeah, I'd love to do sports medicine. That could be something I might look into. I think I'll make that decision a bit more down the road. I'll do 3 years of internal, and at the end of that, I'll decide how much further I go. So we'll see.
Now, did being outside the U.S. kind of give you a different lens on the whole healthcare system as a whole, or did what you know from the U.S., whether that's talking? Well, I guess your dad. You said your dad studied abroad too, didn't he?
Yeah, yep.
So I guess just talking to other people or like through school, and then your experience there, did it kind of give you a different perspective or lens on healthcare, being abroad versus being in the U.S.?
Yeah, it's definitely different. I mean, I would say the healthcare there, probably a little bit more socialized in the sense that everyone gets some healthcare, but if you want something urgent, you might be waiting on it. Or like I had a Hungarian friend there who had Crohn's disease, excuse me, and they wanted the next best treatment, but it just wasn't available there in Hungary. So I would say just by default, because it's not America, they might not have as much access to things. Or if you do need an urgent operation or something like that, you might be waiting a bit more. Whereas here, like, the healthcare is not perfect, obviously, but but I, I guess it's a tricky topic, but but you have the ability to get those things that you want taken care of. But it's a work in progress for sure with healthcare, and it's evolving. But I hope we're getting on the right track with it.
So looking back now on like a personal level at that whole experience, what did your 6 years in Hungary kind of teach you about yourself, or what kind of doctor you eventually want to become?
I think, looking back on it, I think it's that personal. I mean, it is that personal relationship. It's really knowing people at that level and for their differences, especially when it comes to cultural. For me, it was just such an important thing. I think just where people come from, their outlook on life, and using that to treat the patient. In the sense that you can really get the best patient history by listening to them. Because I mean, for example, like I'll just give you an example. If someone gets diagnosed with cancer in Hungary, a lot of times it's like a death sentence. Like they don't think outside the box of, oh, is this more benign? Is it treatable? Is it not? Like they hear cancer, they think it's a death sentence, right? Whereas patients, for example, they used to tell us, like in England, their first thought would be they hear cancer and they'd be like, well, there's some options. What are my options? Or it's probably not that bad, or let me see what else there is to happen. So perspective and learning how to deal with patients, knowing where their mind is at on certain things, really helps you to kind of listen and take in and give the best treatment possible. I think all docs are equipped with understanding of medicine, how to treat, how to diagnose, how to treat, and manage. But paying special attention to what that patient's saying, and knowing where they're coming from makes a big difference, I think. So.
For sure. I was reading a book this last month. I think it's called Super Communicators, and there's a section in there. They had a bunch of different people from lawyers to doctors they were kind of giving examples of throughout the whole book. And there was a section in there talking about a doctor, and I believe specifically it was like prostate cancer patients, and whether or not like they wanted to do whatever the surgery was that could have some sort of potential negative risks, or just leave it and monitor it. And the doctor believed for like 80% of these patients they were better off just kind of leaving it and monitoring it. And the way that he communicated with the patients always led them to the patient choosing kind of the opposite of what he recommended or thought was best from them. And they kind of just broke down the very specifics on like how to actually be in the patient's shoes and like communicate what you're thinking. Cause it's like usually they're just going to like worst case scenarios right away. And I guess the importance and role that has. And I've even had clients too that have some wild, I don't know that I'd call them diseases or just other medical complications. And it's like doctors have pretty much told them that they have zero control over anything in their life and like almost made them hopeless, versus it's like there's so many other things that you can control that are going to, might not get rid of whatever that thing is, but it's going to increase like your quality of life, whether that's, I mean, on my level of things, obviously I'm not a doctor, but I'm just like getting people to walk more, eat better, like those very, very, very basic things. And I think the communication aspect, like you're talking about, and like the patient to doctor connection is so important. What do you think is like a big misconception that people have these days, even from looking at like preventative healthcare to, are you familiar with Dr. Peter Szekely?
No.
He kind of talks about like healthcare 1.0, healthcare 2.0, healthcare 3.0, and like 3.0 is very focused on like the preventative things, versus like 1.0 is just diagnose, prescribe, treat.
Yeah.
Where are you kind of at on maybe that spectrum of more preventative measures in healthcare versus just somebody comes in, they have a problem, fix that problem and go out, but maybe not really focusing on those root causes?
Yeah, I mean, it's a great question, and I think first and foremost, preventative is the way to go. Like it's always important to not have to treat people with medications. Like our goal is always to get people off medicine if they can be. So in retrospective, kind of looking back at all that, you would want these patients to live a healthy, active lifestyle, put in good food to your body, and regulate that kind of stuff. Unfortunately, I think like as far as misconceptions, it is true. There's a lot of probably overprescribed medications out there, but some people will put the entire medical field into that category. When I do think in reality, doctors are trying to help you as best they can. Unfortunately, a lot of the patients that come in are already pretty far progressed in the sense that maybe they choose not to make those lifestyle changes or to make those changes. And so it gets to a point where some things are, they might be not as reversible. And so you got to manage that. It's like acute. You got to manage it now. Otherwise, things will get too far progressed and the health of that patient's at risk. But of course, I think preventative is the way to go. Healthy, active lifestyle, keep those sugars low, exercise regularly, drink lots of water, just reduce that overall inflammation in the body and whatnot. But yeah, I think it's important, like go in for screenings, get checked out, but again, I don't think all docs are in there to hurt you. Some of these medicines like are really needed, so yeah.
For sure. I think COVID definitely had there's positive and negatives to come out of that. I think there's a lot of people that just instantly, they're like, all doctors and traditional medicine is bad and we need to avoid it.
I know.
I think, I mean, no matter what it is, taking the extreme side of things, whether it's a diet and doing like keto carnivore versus just paying attention to like the basic things. It's like, if you take any extreme side of anything, I think that's never the right option for sure. But obviously there's still a bunch of room for, I mean, every area of things to improve. Do you think we need like more layers to the healthcare system versus it just kind of being like, I feel like you got your kind of base level, like personal training, nutrition coaching, and then it's like there's a whole gap between, some people choose to do that, not a whole lot. And then from that gap of, if you want to call them healthcare professionals, there's a massive gap up to, all right, now you already got a whole bunch of problems. Now I'm going to go finally see a doctor. Do we need to add more layers in there? Or how do you think we kind of bridge that gap?
I mean, that's another good question. I think that it's an evolution. It's obviously an evolutionary kind of process, but to bridge that gap, and I do think that medicine is heading to a more personalized route, especially with onset of like AI and maybe more personalized medicine that's going into it. So I would say technology will probably help to bridge that gap between those, where you are getting more, and for example, virtual medicine and things like that, where some docs will be paid to check up on patients more regularly rather than just being able to have to come into the office all the time. Of course, coming to the office is absolutely necessary, and you need to come in to be actually physically seen. But I think that with technology, and I think that that's where we're headed. I think that's where we're headed, and I think that'll help to personalize that. For example, I've heard a lot of people talk about looking at their gut microbiome, and how can we improve the gut health to help the brain health, and the whole body in general. So it's a lot of cool stuff. Or looking at different types of oncogenes, and kind of understanding our bodies at a more in-depth level, which is extremely complex. It's extremely complex, but I think the technology is going to bridge that gap.
If you could snap your fingers right now and like change one thing about the healthcare system in the U.S., what would it be?
Man, Bridge, that's a big question.
Gotta pick out one.
Pick out one. One thing to just kind of just like to get rid of or to change, or
it could be adding something, getting rid of something. If you just snap your fingers right now and one thing is different tomorrow.
Probably access to probably access to just like more personalized health. I would just say that like it's a tricky question. I would just say I would just say that everyone has the same access to all the options that are available on the table, whether it's your exercise, your diet, just like someone to be able to see a full broad picture of all these things we have going on. So I'd probably have an application you could put on, gives you a broad perspective of all your different options based on, your body type, your diet, your way of life, and just let people get more educated. So I guess that would be a point: education. Really, really getting people to get more educated on these things. Many people hear things, they watch reels, they get a quick conclusion. It's never the big picture. It's just never the big picture. And I've had a lot of talks with people about these kind of things. They're like, "Oh, this is the new way." I'm like, "Well, okay, but you aren't educated on a lot of these other things, so let me just hear me out." So, not to underestimate them, but just that there's always more to the picture. So, education, round story.
I feel like it's a big onion in things where it's like people see a reel and it's like, all right, that's one layer. There's 30 more layers of this onion that you got to kind of understand to get the clear picture.
Oh yeah.
I'm constantly breaking those down at a very base level as a nutrition and personal trainer, as a nutrition coach and trainer. So I'm sure like once you get to your level or being whatever in the internal medicine field, it's like, and you only have a certain amount of time with people as well. So
that's another point. Another good point.
But between increasing education and like access to it, how do we do that without, or how am I trying to say this? How do we filter out all of that, the crap, or is there a way to filter out the crap to give people real answers, not just surface level of the onion clickbaity trends that are?
Well,
yeah.
I guess I'll look at it from this way. If my point is to have people be more educated on these topics, it would be nice for the doctors to have more time to educate them on these topics. So I think you could probably, by the patient spending more time with their doctor and making it more personalized, and maybe that's cutting down on the number of patients they see per day, but there's another side to that. Everybody wants to get seen. But if there was more healthcare providers and they had more time to be with each patient, to maybe get more in depth and do more education, rather than the patient coming in feeling like he knows, he's giving, that's it, I would probably say more time. That's probably another thing I would snap my fingers and add into that. So
for sure,
because I mean, like everybody wants that.
Well, I want to cover a few kind of common myths, or you said you get a lot of questions, or these surface level reels. What are the most? Well, let's go with 3 of them. What are 3 of like the most common things that maybe people have asked you or brought to you or sent you a reel, and you gotta like, all right, you gotta break this down a little bit more to truly understand it.
Yeah. I guess one maybe is, for example, like carbs. I mean, if you just break down the, kind of macronutrients, the body always utilizes carbs first, then the fats, and then the protein. And some people just say, hey, all carbs are bad. It's not true. You do need some carbs in your diet, and they are the quickest form of energy that you need to consume. And obviously, I know it's pretty common for people that maybe have inflammatory disorders to talk a little bit about the carnivore diet, which I think is good. But whether you're a carnivore or you're a vegetarian, it's always important to kind of know what am I getting and what am I missing. For example, with meat, there's not as much vitamins K, A, D, and E, those fat soluble vitamins, and there's no source of fiber in meat as well. So supplementing, not just saying like all meat. I'm not going to eat a single vegetable. Or on the other side of things, people that are, for example, vegetarians, there is some forms of iron in vegetables, but it's not the heme form. So the one that really binds oxygen is the ones found in meat. So consuming that. Meat's also high in vitamin B12. And if you don't have, for example, iron or vitamin B12, you can get anemia. There's different types. If you don't have vitamin B12, you can get macrocytic anemia, which is a big red blood cell. Or if you don't have enough iron, you can get a microcytic anemia, red blood cells too small. So I guess to kind of get a little more general with it, it's just, I would say that's one of them. Knowing your basic nutrients, all of them are necessary, and keeping it balanced. So educate yourself on what's in it, what's not in it, how much does the average person really need to maintain themselves. For example, vitamin B12, most people have a storage of vitamin B12 for up to 2 years. So to get deficient, it would take you a couple years. So you're thinking more maybe, so where's B12 absorbed, in the small intestine? Trying to remember if it's the duodenum or the ileum, but one part of the small intestine absorbs that, and then the iron. So maybe they have a colonic problem. They're not absorbing well. So there's always things to keep in mind when you're looking at the broad picture of these kind of things. Another real, I mean, not to get too in depth on it, but I think someone was asking me about like a hypertensive crisis, or like they saw some reel that there is a drug called furosemide, and it's like a diuretic. It helps to get fluids out of the body. And so they were calling that a salt pill, which it's not. It helps to get rid of salt, and then water follows salt. So that's how you get rid of the water. And then they were also saying that with this patient that's a hypertensive crisis, why would you give them normal saline? Because sodium chloride is sodium, and chloride and salt is, raises blood pressure. So why would you give something that raises the blood pressure further? But what the video didn't talk about was the fact that you're giving somebody that to replace the dehydration, but we're also giving them another medication called like clonidine, for example. And that medication acts on these alpha receptors and helps to lower the blood pressure. But they didn't mention anything about that. They just wanted to talk about the fact that we were giving salt to a hypertensive patient. So that was kind of funny. But and then I had another
one. Touching on that one too, because like the whole like element and all the electrolytes have been such a, I don't know if you want to call it a trend, but have become so much more prevalent. And I feel like so many people just don't really understand what the role that salt plays, where it's like, yes, salt isn't necessarily bad, and we do 100% need it. And if you're eating a healthy, clean diet, you're going to benefit from adding some salt in. The majority of people think that salt's bad because they're eating terribly processed foods that already are very, very high in sodium. But also, if you're somebody that you're not an endurance athlete or somebody that's sweating a ton, and if you're throwing down 4, 5, 6 sticks of element a day and you're having, I don't know, close to 10 grams of sodium a day, like where does that, I guess just talk about like the role of salt in where too much can become too much, And yeah.
Well, I mean, so obviously salt, one of the biggest things with salt is number one, osmolarity inside the blood. And then also blood pressure. So your blood always has a certain osmolarity, a concentration, and osmolarity basically is telling you what is the ratio of salt to water inside your body. And if it's too diluted, meaning you have more water than salt, that's a problem. That's outside of homeostasis. If you have too much salt and too little water, you're dehydrated. That's a problem. And so keeping it in that range. One of the and we look at that a lot, obviously, looking at blood osmolarity and seeing if someone is hypo or hypernutremic, they call it. That's salt, high or low. And then also the kidneys play a big function with salt. So there's a big system that you'll learn about in medical school, and many medications act on it. It's called the renin, angiotensin, aldosterone system. And basically, hormones like aldosterone are produced and they act, I mean, in short, they act on the kidney and they help to reabsorb sodium and what they call the proximal convoluted tubule of the nephron of the kidney. So every kidney has these little components on it, and all of your salts are either reabsorbed, and because sodium is osmotic, it pulls water with it, or it releases it and lets it go. So when somebody wants to raise their blood pressure, the hormone aldosterone turns on, it goes to the kidney, it opens up some channels and allows salt to come into the body. And then water follows it based on attraction. And then that raises the blood pressure up. And then there's another hormone called ADH. It's called antidiuretic hormone. And that one will then go down also to the kidney, and it opens up these little channels called aquaporins, and the water follows it, and that helps reabsorption. So your body is in a constant state of homeostasis to help keep the blood pressure in a certain range. So salt is incredibly important, you know. It's funny, there is this disorder that you probably know about, but it's called psychogenic polydipsia. And what that means is like there is these people that drink a ton of water. Sometimes it's a mental disorder. They chronically drink a lot of water and they dilute all their salts. And, they pass out basically because their salt is too low and they've drank too much water. But it's reversible once you stop making them drink water. So anyway, it's pretty cool. I think understanding the role of salt is very important. Obviously, if you have too much salt intake, you had a high salty diet, yes, for sure, that can increase your blood pressure. I did read something kind of recently, and it was just talking about the categorization of people with hypertension or high blood pressure and like what reduces it the most. And I think first they talked about diet. Second was exercise, and then third was sodium intake, and then there was another one after that I can't remember, but basically a good combination of diet and exercise is probably the most important for dealing with blood pressure. But again, really important to keep your body in homeostasis. It doesn't work properly if it's not. And the concentration of salt to water in your blood is, it's very imperative. So whether I'm giving fluids to a patient who's dehydrated, you need to know how much to give them, things like that. You don't want to give them too much and you don't want to do it too fast. So things like that. Pretty cool.
I think that goes back to the whole conversation too before of like not absolutes, and everything is kind of that you can have too much, you can have too little. It's all about the homeostasis. Too much water can kill you, too little water can kill you.
Yep.
Same thing with whatever it is these days, whether it's like artificial sweeteners that people are talking about or anything. It's like it's all the poisons in the dose. So
Yep.
it's not all just absolutes that one thing is going to kill you no matter how much you have. So
yeah, absolutely. Good point.
You got one more for us?
One more. Oh man. I did hear one about Hashimoto's thyroiditis. Basically, that's an autoimmune disorder where the body, where the immune system attacks the thyroid gland. And when it does that, basically, these patients go into a state of hyperthyroidism, which means their thyroid levels go up. And then after it completely destroys the thyroid, they completely crash and they go down to zero. But I'm trying to think back to the exact details of the video. This guy was trying to say that Hashimoto's thyroiditis is not an autoimmune problem, but more so just about replacement of iodine. And I was like, absolutely not. I mean, the immune system is attacking it and destroying the thyroid. And, obviously that's where iodine is absorbed and iodinated. And it's, anyway, he wasn't really talking about the fact that Hashimoto's is an autoimmune disorder. He just talked about on a supplemental level, but it's not true. So that's probably the one other one I can think of. Obviously, these patients that are hypothyroid, they become hypothyroid. They need thyroid replacement therapy with like levothyroxine and things like this. But yeah.
Is that a common thing or issue that you see? I mean, I see a lot of people going, it's like, you have thyroid problems or something like that, just take iodine and it'll fix all of it. It's like these kind of one hitter solutions to things where it's,
yeah,
maybe like what percentage of people do you think actually, like, I mean, for a variety of things where it's like you see people on Instagram and they're like, take this one supplement or this one vitamin and it's going to fix things. Like, it's maybe 5% of people that'll actually work, but for the majority of people, there's a lot more to it.
Yeah, there's always more to that story. I mean, like, does the person, like, why are they deficient? Are they not absorbing it correctly? Is there a problem with the absorption route? Is there a problem with the actual organ itself? So there's always more to the picture. It's not as simple as giving a vitamin. There's many interactions that happen to get that vitamin from where it's at to where it's going, and there's more vitamins at play. So lack of one vitamin might lead to malabsorption of the other one. So that's why people always take calcium and vitamin D together. They're required together for absorption. And let's say someone doesn't get enough vitamin D, they're not in the sun. Well, maybe you won't get as much calcium absorption. So you always got to look at the big picture. It's never a one thing fixes all. You got to look at the whole thing. Why is that patient there? What else is going on? What's their medical history? What's their diet? All these things are so important. And then we do evidence-based medicine. So you test those things and see if they reverse or not. Can we find an answer to those problems? If it is as simple as maybe, for example, like females, they have their menstrual period every month, they lose blood. Common type of anemia is iron deficiency anemia in females because they lose a lot of blood every month. Men don't. So sometimes it's as simple as giving an iron supplement replacement. So okay, that one fixes that. But does the patient have something else going on? So it's important, or malabsorption problem. It's always important to think about everything, not just consider one thing. And that's why reels are so misguiding, because they tell you one thing immediately, but they don't tell you the whole book.
Mm-hmm.
So
yeah, I mean, that's why I struggle with it, because it's like all the people that are huge in the fitness and health and wellness space, it's like they're just giving all those kind of very quick surface levels to things, and I'm like, that's not true. Or like, there's so much more to that, and it just pains me. So like, yeah, it's hard for me to make reels, because that's why I've loved getting into like podcasts or even YouTube, because it's like you can explain so much more and give people the whole picture versus exactly what we've been talking about.
I know. We have a shallow society. They want a quick fix. They want a quick answer. They want that quick dopamine rush. It's just not reality.
Exactly. Well, sweet. We got two more questions to wrap it up. First one, what's one habit or belief that you believe has got you through swimming career, got you to swimming in college, got you through medical school, and led you to where you are now? If you had to pick out one habit or belief.
Persistence. I mean, hard work and persistence. I don't know if those go hand in hand, but just like never giving up. I think for me, that's always been my strong suit. Is I really don't quit. I just never quit. I'm going to get up and do it again. Even if it wasn't great yesterday, I'm going to try again to get it there tomorrow. Never stop. Whether it's your career, whether it's your finances, whether it's your personal health, your faith life. You got to keep working at it. If you don't use it, you lose it. And for me, keeping at it, never stop.
Getting 1% better every day.
Yep.
Now, fast forward 10 years. Where do you want people to see you, or what sort of impact do you want to have on the healthcare space?
Kind of bit back into what we were talking about earlier. I'd love to have a more personalized relationship with my patients. I think for me, like, that stands out. And I know medicine has always been big volume, not much time. But I would love to have a very personal interaction with many of my patients and have more time with them. And I hope medicine turns into that, not just 15-minute slots. I love that. So obviously there's a lot that goes into people getting paid and how much they do, depending on how many patients they see. But I really hope that both of those can come to the level where you can see that many patients, get paid, for the time that you put in, but really make sure that each person you see is being taken care of fully. So I envision that for my future, and I hope it comes true.
Awesome. I love it. I mean, you definitely got a good career ahead of you for sure. Looking forward to seeing where you're going. Appreciate you spending some time with us today, coming on, dropping a lot of wisdom and value and knowledge for people. I mean, I'm sure we can get you back here because you definitely have a wealth of knowledge that you've accumulated over the years. So
thanks, Bridger. I appreciate it. I just want to say thanks for having me on. I always love seeing you. I love what you're doing. And I'm excited for our next venture.